Hello world! So today's video is all about the acupuncture needle. I get the question all the time from new patients, how will the needles feel? Most of them are very nervous, and if it's their first time, they're trusting the practitioner a lot with their body. So I like to make sure they feel comfortable and relaxed the entire session. I normally start out by letting them know if they feel any sensation at all throughout the entire process of me needling, to give it about 2 to 3 seconds or a deep breath or two for it to dissipate or go away. If it does not go away, that's when I have them let me know so I can adjust the needle or take it out completely. The goal of the entire treatment is for you to feel relaxed, so relaxed that you might fall asleep. So if any of the needles are interrupting that process, then it's best that we take them out, especially for your first time. If you are going in for something more chronic or severe, you might expect a little bit of a deeper needling technique involved, which might include pain. Kind of just depends on the treatment protocol and that practitioner. There are many things that influence how the needles will feel. One is the area of your body. Two is the patient themselves and how sensitive they are to touch or any kind of stimulus. And also the practitioner themselves. Needling technique that the practitioner uses is a big one. So go in with an open mind and just know that it's all for your benefit and your health and your healing. And just embrace the whole ride. This video will also show you what it looks like when a needle is inserted. Beyond that, you will be expected to lay in the position you are in for about 25 minutes. This does differ depending on the practitioner. Some practitioners also do front and back treatments where they flip you over in between, and then you're on your back or your front side for different amounts of time. It just depends on their modality and what they focus on in their treatments. There are different sizes of needles, all depending on the area of the body you are treating and your intention with the treatment itself. These are Korean hand needles that are often used for cosmetic acupuncture. The needles are very short and thin, which is just enough to go into the skin but not cause any damage or bruising or bleeding when you receive a cosmetic acupuncture treatment. So the most typical needles used are the Wonsun needle, which is this one here. The thickness does vary depending on the practitioner, but this thickness is usually very gentle, and most practitioners use this for their patients because it is so gentle. There's also the Half-Sun needle, which is the shorter needle here. These are excellent for face points or areas of the body that do not have as much flesh or muscle or fat. Anything longer is usually used for areas that do have more fat or muscle that we have to get through in order to fully access the chi. So for this demonstration, I'm just going to show you what it looks like when I needle the point Li4 using a Wonsun needle. You're first going to take the cotton ball and put alcohol on it to clean the area that is going to be needled to make sure you don't spread any infection or have any germs on that area before the needle goes in. You then make sure your patient is in a comfortable position because this is the position they will be in for the next 20 to 30 minutes. The needles are as thin as a string of hair. As you can see, they're barely visible even on this video. The larger part you see there is the handle that the practitioner uses to manipulate the needle in the skin. You then put the needle into the guide tube and you hold the handle against the guide tube, making sure the point is in the guide tube. That way when you approach the skin and you place the guide tube on the skin, they just feel that plastic guide tube. They don't feel the sharp point of the needle. Once you have your point selected and your guide tube aligned, you then quickly press the top of the needle to break that initial skin barrier and make sure that the nerves don't react to the needle going in right away. And as you can see, the needle is erect, which means that it went deep enough in the skin to stay upright, but also did not aggravate the superficial layer of the nerves and cause sharpness or pain when it went in. You can then manipulate the needle once it is in the skin. You can turn it or do different directions on the needle or different techniques depending on what your goal is for that point. Typically this should not hurt. Again, I usually tell patients to give it 2 to 3 breaths to make sure that the needle is in a good position and that they are still comfortable and relaxed. You don't just feel pain or a sensation in that exact point, you sometimes can feel it move throughout that channel, which is just the chi moving in response to us activating it with that acupuncture point. So that's all. It's very painless. Most people are shocked and surprised by how little they feel when they get acupuncture. After that first needle goes in, they always say, that was it? And yes, that's it. So don't be scared. Definitely try acupuncture if you haven't already. And if you have, please let me know in the comments what you think of it, or if you have any questions. I would love to answer those via video.